Well, it's something an awful lot of parents and teenage kids are wrestling with right now, and that's a return to colleges and universities in the fall because of some of the mandates that are coming down for getting the vaccination. At one school here in Western Washington, they have sent out a message as to how they're going to return to campus. The president of Centralia College is Bob Mahrbacher. He joins us here in the Dori Monson Show. President Mahrbacher, thanks for your time this afternoon. I appreciate it.
Thank you.
All right, so what are the guidelines going to be for a return to campus in the fall?
So we have a voluntary program of vaccination, and it's up to students to decide. Where we still expect to have mask requirements as far as we know. The general reopening proclamation doesn't apply to higher education, and we're still waiting to hear from the state level what the specific rules will be. But
let me interrupt. Mask
Yep.
requirements for all, even those who have been vaccinated?
Well, that's as far as we understand, that's the option we'll have to choose from. We can either have masks for all, or we can choose to let people volunteer their vaccination status and then let them go maskless.
Okay, now I heard from a couple of parents, a couple of families at your college there. They said that they felt like things were getting rather coercive because you're going to wear a lanyard. And is that still the plan, that you're going to wear a lanyard if you're vaccinated and not have a lanyard if you're unvaccinated?
Something like a lanyard or a rubber bracelet or something like that. We're putting in a new student ID system, and students will be able to use that to attach their ID card to.
Okay. And one family contacted me, and they said that they felt like that was a form of public shaming, that people are going to be able to distinguish what other people's private medical decisions have been. What would you say to those families?
Well, one will be putting out a lot of messaging to make sure that people aren't making assumptions about other people based on whether they choose to participate in this program or not. And it is all voluntary. There will be people who are vaccinated who choose not to participate. There will always be people who, for medical reasons or other, can't get a vaccination. Those who can get a vaccination help those who can't for medical reasons by reducing the community spread. So it's really a community effort. We don't ever expect that we'll reach 100%.
Right.
But the larger the number is, the less likely we'll have problems in the near future.
And then is it also true that you're offering a $100 cash payment to faculty, staff, and students who get vaccinated?
That is the plan, yes. We'll be using cash cards, basically.
Where does that money come from? What's the source of funds there?
We're still waiting on the specific rules about whether we will directly be able to use federal stimulus funds. The federal stimulus funding asks us to incentivize a vaccination, but some of the rules around how we can use it are still unclear. So if we cannot use that funding, we will use other local funds.
Okay. So now we've established what Centralia College is doing. I just have questions about this. I am not an anti-vaxxer. I am vaccinated. I made the determination that my age and any risk factors that certainly had more benefits than risk for me. I absolutely disagree that it has more benefits than risks for young people. A couple of days ago, the World Health Organization said children and teenage boys especially should not take the vaccine. They said it's too dangerous. They say the risks outweigh the benefits. A doctor named Tracy Hodge says that myocarditis, inflammation of the heart, is extremely high among healthy young people. Are you concerned about a mandate, not a mandate, I understand you say it's voluntary, but are you understand about the people who say They're upset that there are coercive measures being taken when it may have more risks than benefits for the kids who attend your college.
And that's really why we decided to go with a voluntary program rather than with a mandate, so that individuals can choose for themselves. And our students, are all ages. Some of them are still in the Running Start program, are still in high school, but then many in their 30s, 40s, 50s, and all of them have different situations. So this voluntary program lets them weigh their own situation and make a choice.
But why incentivize? I mean, because we're starting to get a lot of data, a lot of science. I'll give you another example. Two medical profs at Yale and UCLA who work with the VAERS system, which is the database, the kind of the be-all, end-all of COVID stats. And they said elevated myocarditis, low platelets, deep vein thrombosis. They've had lots of cases of that. In the Wall Street Journal, they wrote, the risks may outweigh the benefits for low-risk populations. You have a very low-risk population. Why incentivize? Why give $100 to kids if what they're choosing turns out to be the more dangerous health option for them?
So, one, the idea that our student population is kids is not quite accurate.
I have three daughters in their 20s and 30s, and I use that colloquially, not in a legal sense.
Right. And so, again, that's just why we've made it a voluntary program. And I think the incentive program is not going to sway those who have specific reasons for not getting vaccinated. I think it's most likely to sway those who are just kind of procrastinating and thinking they will get vaccinated but haven't done it yet.
I understand, but there is a growing body of science that says what you're incentivizing, if it is a healthy young man or woman, that what you're incentivizing may turn out to be the higher risk choice. And that to me, what happens if some of these things happen to the kids? The heart swelling, the deep vein thrombosis, the low platelets. Do you feel that Centralia College would have any exposure to that, to a liability?
No, it's really up to individuals to consult their doctor and consider their own situation.
What if somebody has had COVID and has the antibodies? Would they get the lanyard, and would they be eligible for the $100 if they're as safe, or more likely, much, much, much safer than somebody who's gotten the vaccine?
No, not that we know of. I think they could just choose not to be vaccinated.
Okay,
that was their choice.
And I really appreciate you coming on and answering all my questions. Because here's my fear, though. I would just love to, as we wrap things up, get your response. My fear is that there's something going on globally here. Moderna stock was $18 a share at the beginning of last year. It's now over $220 a share. They had a market cap of $7 billion. It's now over $88 billion. There's a lot of money at play. And my fear, sir, is that to continue to drive stock price, to drive earnings like they've had over the last several quarters, my fear is that our young people are being targeted in a campaign that's more about pharmaceutical companies than about the health of the young people. What would you say to somebody like me who asserts that?
Yeah, I couldn't weigh in on the situation of the pharmaceutical companies. I just have to do what we can to get our college back to normal operations as quickly as we can.
Okay. All right. Like I said, I really appreciate you coming on, talking with me about all of this this afternoon, sir. Thank you for your time. You're welcome. Thank you. All right. Bob Mahrbacher, he's the president of Centralia College, where they will be offering students and staff a $100 incentive if they get the vaccine. I'd love to hear your thoughts. You can text me at 98973. That's 98973. Lots more to come here on the Dori Monson Show.